Now, Pfizer is working on a new drug that could help treat COVID symptoms after someone's contracted the virus.
The South Bend Clinic is just one of dozens of healthcare systems across the country participating in the trial's later stages. One of the doctors leading the study told me how people with COVID here in Michiana could be the key to unlocking a whole new way of fighting the virus. No needles required, and it's as easy as swallowing your daily multivitamin. The South Bend Clinic is testing out this new way of treating people infected with COVID.
This is a very effective treatment for COVID. If you're at low risk, it can keep it from progressing. If you're at high risk, it may prevent hospitalizations or worse. And so we're very excited about this option because it's a very quick, easy treatment. It's much like the treatment we use for the influenza now, which is called Tamiflu.
The Pfizer pill is paired with a low dose of another drug called ritonavir, known for its role in combination treatments for people with HIV. Together, they work to block the virus's ability to multiply in the body.
These are well-known drugs. They're not necessarily experimental. They've been out there for a long time, but they have been shown to be very active against COVID when put together.
Dr. Harris says results from earlier phases of the trial back up that claim. Those results also suggest the treatment could have minor side effects consistent with what some people experience after getting the COVID vaccine.
It's the first and only option for oral therapy, so I think it's an exciting option for people that may be reluctant to consider IV therapy and want to do everything they possibly can to prevent hospitalization. The early results have shown it to be safe and effective, and so it has been tested. It's not completely brand new. This is just a larger number of patients that would be enrolled.
If the trial is successful, Dr. Harris says this treatment could be available as soon as early 2022. And it is important to note ritonavir is not recommended as a treatment for COVID on its own, which is why a low dose is being combined with the Pfizer pill. Naturally, they need patients to volunteer for the trial, roughly 100 of them, and roughly half will get the Pfizer treatment. The other half will get a placebo. You can stay tuned at 6 when we tell you who's eligible to participate and how you can get started.